Welcome to the Mindful Return podcast. I'm Kelly Tuttle, a retired neurology nurse practitioner and brain injury survivor. Together, we'll explore practical tools and real stories to help you rebuild focus, confidence, and a meaningful life after a brain injury. Hello, and welcome to the Mindful Return. Thank you for joining me for this episode. In this episode, I will be talking about post-traumatic headaches after a brain injury. Before my brain injury, I did suffer from migraine headaches, and they were pretty frequent. But after my brain injury, they turned out to be a horrible monster of a thing. They were pretty much every day. And the pain also changed. So I still had kind of like that migraine kind of feel, like that pain on one side of your head and in your eyeball. But then there was this like unbelievable, like clamping type pain, like on the top of my head. It was so awful. It was so bad I couldn't get up and move. Like if I wanted to go to the ER for help, but I couldn't even get up and move. That's how bad it was. It was some rough stuff. And it is common to suffer from headaches after a brain injury. Even if you're a headache sufferer prior to your brain injury, those headaches can worsen. And a history of headaches, migraine headaches, can prolong your recovery from your brain injury, put you at a more risk of a longer recovery. Headaches following a head injury are often referred to as post-traumatic headaches, and they can range from just a slight discomfort to being just severe and debilitating pain. You may experience headaches for a few weeks after your brain injury, while others may suffer for years after their brain injury. Everyone's symptoms is different. Everyone's recovery is different because everyone's brain is different. After a brain injury, your headaches may feel different than usual. The pain can shift locations, the type of pain. So it can maybe be less of a stabbing to a tight pain or a throbbing pain. It can range from a mild headache to sharp pounding or burning sensations. The intensity of the pain can also change, varying from mild to severe, and you may experience an increase in number of headaches you have each month as compared to the number of headaches you had each month prior to your head injury. So pain from headaches drains brain energy and worsens brain injury symptoms. So that's why it's important to get as much control over your brain injury pain, so in order to support the healing of your brain. The other thing about headache pain is that it can affect your work performance. It's very hard to focus and concentrate when you're in pain, and it can make you irritable, and it also can make you miss days in the office or at work. So getting control over your post-traumatic headaches and pain is really important. Types of post-traumatic headaches commonly seen after a brain injury. One is a tension headache. Generally, what you'll feel is like a tight band around your head from the front to the back, and it just feels really tight. So that's a tension headache. Migraine headache can occur. This type of headache causes pounding, pulsing, or throbbing pain on one side of the head and can sometimes cause stomach upset, nausea, or vomiting. Another headache, and I definitely had this one, is occipital neuralgia. And this condition causes severe, sharp, or throbbing pain that starts from the upper neck and may radiate to the back of the head or ear. And it's usually due to nerve injury beneath the scalp. Often you'll see this with whiplash. Another headache that can happen is called cluster headaches. As their name suggests, they often occur in groups or cyclic patterns, and they are regarded as one of the most painful types of headaches and often cause sudden intense pain in and around the eye, frequently waking individuals during the night. And then the last headache I'm going to talk about is called a rebound headache. And this one is one you really do not want to develop And rebound headaches are extremely uncomfortable and can occur when taking large amounts of over-the-counter or prescription pain medications frequently throughout the week. This can lead to dependence on these medications. The body gets used to having these medications at certain levels in your body. Some common medications that contribute to rebound headaches include aspirin, ibuprofen, also known as Motrin, and acetaminophen, also known as Tylenol, and caffeine in coffee and beverages. To treat rebound headaches, it is necessary to stop all pain medications for at least 3 months. And that includes no caffeine for 3 months, a complete washout. And going through this washout period can be challenging. So it is vital to do so under the supervision of a healthcare provider, your general practitioner, or a headache specialist. Do not attempt that on your own. So the first step you want to take in managing your post-traumatic headaches is to see your primary care provider. Clear communications about the symptoms and your headaches is imperative. And I would recommend that if prior to making that appointment, that you go to my website, kellytuttle.org, and download my free medical stress list worksheet and fill that worksheet out prior to seeing your doctor about your headaches. It's going to have all the questions your doctor's going to want to know in order to make a plan of care for you. So please go grab that, share it with your friends and family, make lots of copies, enjoy it. But that will definitely get the most out of your visit with your doctor when you fill that out and then read through it at your visit with your doctor. So you'll want to see your general practitioner, and they're going to want to know also you've been taking over-the-counter medications like the aspirin or the ibuprofen. If you are taking those medications, or if you haven't started, you should ask your doctor after a brain injury if it's okay to take aspirin or ibuprofen, because these medications can make brain bleeds worse or reoccur. So sometimes there's a time frame that you need to avoid those medications until your doctor clears you for you being able to take them. So make sure you check with your doctor if it's okay to take those medications prior to starting them. Then the other thing you want to do, which is really helpful, is to take in a journal of your headaches. And headache journals are best to keep in a calendar, because if you have like a calendar that's a month at a glance with big boxes, every day that you have a headache, you can write how long you had a headache, a little note like some description of the headache, maybe how long it lasts, and if you took some Motrin, did it help the headache go away, or did the Motrin not help? So keeping it in a calendar like that is really useful. So when you're talking to your doctor or your headache specialist and you're communicating how your headaches are progressing, you can clearly communicate how many days a month you're having the headaches, and is the intensity of your headaches going down over time, or is it going up, and so forth. Are the medications you're taking being effective, or they're not? So the headache journal is going to be super key in helping you manage your headaches and getting the help that you need from your headache specialist. The other important thing about headache management is you have to optimize your lifestyle. If you have a poor lifestyle, even effective headache medications will not work as well or work to control your headaches as well. So the lifestyle recommendations that your doctor's going to make are really important to helping you manage your brain injury headaches. And a healthy lifestyle will help support the effectiveness of the medications that your doctor's going to prescribe. So some of these healthy lifestyles are: 1, you need to get 7 to 9 hours of sleep. If you are having difficulty sleeping, let your doctor know so that he can treat your insomnia or your fractured sleep. Having sleep difficulties after a brain injury is real common. And so your sleep will be the foundation of helping you control your brain, your headache pain. One of the first lines of treatment for insomnia after a brain injury is melatonin. And melatonin has been shown to help with migraine control because it has an anti-inflammatory component to it. But don't start that on your own. Talk to your general practitioner to make sure that medication is safe for you to take. And then if you're having difficulty controlling your headaches, the other thing you may want to have done is to be screened for sleep apnea. Sleep apnea is another common sleep disorder that can occur after a brain injury. And if it's untreated, it'll make controlling headaches and managing your brain injury symptoms very difficult. So even if you think you don't have sleep apnea, you should have the test done, because a negative test is helpful information for your provider to know, okay, this has been taken off the list. I know this isn't going to be a problem that is interfering in this patient's headache management. And when I would talk to patients about sleep apnea screening, they would just say, well, I don't think I have it. And I would say, yeah, but you being screened and it's negative is just as helpful as you being screened and it being positive. So please have the test done. And then if with your brain injury, you suffered any neck pain or strain, you need to make that a priority to get treated. And I will do another episode about neck pain. But if you have neck pain, then, you need muscle strain, or if it's, you're having to tilt your head or have strained muscles, that needs to be addressed and taken care of in order to control your pain, because a lot of headaches are caused from issues with the neck. So make sure you have your neck evaluated and treated. Usually seeing a physical therapist is helpful in managing that. Another healthy lifestyle strategy is to exercise. And this is going to vary from person to person, but exercise has been shown to help with headache management. So it's important that it is implemented into your lifestyle to help with your headache management. And the recommendations normally is walking 30 minutes most days of the week, 3 to 5 times a week. But some brain injury survivors can't walk, or they don't have the energy to do that type of walking. So you would have to be a little bit more creative, which can involve like chair yoga or chair exercises or shorter intervals, such as just walking for 5 minutes. So just doing whatever you can, any movement will help improve your headache management. And then it's important to eat a very clean, healthy diet with vegetables, fruits, beans, whole grains, and nuts, and eliminate processed foods and dairy and animal foods to help support controlling your headache pain. So a really clean diet, eating more closer to the ground and the farm and farther away from the factory is your best bet. So try to implement that into your lifestyle as much as possible. And then you'll want to avoid alcohol and then be really cognizant of the amount of caffeine that you're taking in, because those things can aggravate headaches. And then managing your emotional stress, and that could be done with mindfulness practice, practicing being grateful, journaling, breathing exercises, yoga, getting outside, spending time outside, gardening, anything that you can do to just kind of get you out of your head, away from stress. And if you're having difficulty managing your mental stress, then of course, see a mental health provider for some talk therapy to help you with that. While at work, you can request an ergonomic evaluation of your workspace. That is really helpful because sometimes we're not aware of how we're sitting or our arms are placed. That could be worsening our body dynamics that can make neck pain and so forth, things like that worse. Maybe it's how your screen is placed, the height of it. An ergonomic evaluation of your workspace can be really helpful if you're in a job where you work at a desk most of the time. When you're at work, try to limit headache triggers at work, such as dimming fluorescent lights and limiting exposure to blue light. And managing your neuro fatigue is going to be really important because when you get tired, pain gets worse. So you'll want to practice pacing throughout the day and taking breaks as you need it. You'll want to also avoid nicotine or cigarette smoke. They can alter the neurotransmitters in your brain, and they can affect your brain reward process, your cognitive executive function. It can also worsen your impulse control and interfere in the formation of new brain cell connections and lower oxygen levels going to your brain. So if you're thinking about quitting using nicotine products or cigarette smoking, let your general practitioner know so they can help you with that. And then you'll want to remember to stay hydrated throughout the day and don't skip meals because drops in blood sugar can trigger headaches too. So if you're having increased headaches or persistent headaches, like I said, follow up with your general practitioner, your primary care doctor, so that they can evaluate your headaches and make sure that there's not anything going on like a slow bleed in the brain after a brain injury. The other thing, your doctor can help you identify the type of headache you're suffering from and provide the treatment that would be most effective for that type of headache. Your doctor then should be ordering blood tests to screen for things like thyroid levels. If the thyroid's working too hard or not enough, that can cause headaches. Again, screen you for sleep apnea, and then do a basic metabolic panel that measures blood sugars and electrolytes. You may consider having your B12 level also checked because a low B12 vitamin level can increase headaches, fatigue, and cognitive issues, and a low vitamin D level also can cause headaches. If you're having headaches where you're needing to take over-the-counter medications 2 to 3 times a week, talk to your doctor about adding on a preventative headache medication. I know the last thing you want to do is add another pill to your life, but preventative headache medications are key in managing daily chronic headaches, and they also help lower the frequency, the number of headaches that you have in a month. They lower the intensity of your headaches, and they support the effectiveness of abortive medications such as like Imitrex. So preventive medication is definitely an option in managing your headaches. And just remember that when you start these preventative medications that you don't have to be on them for a lifetime. It's just until your brain heals and your post-traumatic headaches resolve. And that could be just taking the medication for 6 months to a year or maybe 2 years, depending on your headache pain control. But they're usually not normally after a brain injury needed for a lifetime. But if they are really effective in managing headache pain. Now, the thing with these preventive medications is that they are tricky, and a lot of them, when you start them, you have to start at a really low dose, and this is to minimize side effects, and then slowly increase per your doctor's instructions. And then you'll get to a point where you're at the recommended dose. It's at a therapeutic dose. Once you are there, then you have to take the medication for at least 2 months to know if it's going to work for you or not. And over that 2 months, you're going to need to track your headaches in your headache calendar to demonstrate whether if it worked or not for you. So the process of finding the right one for you may take a little while, and you're going to have patience in the process, but that's just to get the best outcome for you and your headaches and to do it safely and effectively. The goal of preventative headaches isn't a preventative medication is not to get rid of your headaches 100%. It's nice if that is what happens, but it's not necessarily always true. You'll still have people who take these medications will still have breakthrough headaches, but the goal is to reduce the number of headaches by 30%. That means the treatment is effective, and it is to, like I said before, decrease the number of headaches you have, decrease the intensity, and increase the ability to control the pain with abortive medications. Now, if you've seen your general practitioner and they've done the best to try to manage your headaches, if they haven't been able to do it, they can refer you to a neurologist. Now, this is when you should see a neurologist after a brain injury, because they are really good at helping you manage your headaches. And also if you have seizures, they're good at managing your epilepsy. And so usually when you're referred to a neurologist, that neurologist may specialize in headache management, or they'll have like a headache management or a headache clinic. And in that clinic, you'll see a nurse practitioner who's been trained by the neurologist on how to manage headaches. And they're really great at helping you with your lifestyle challenges and supporting that and screening for missed things and trying options and changing medications that maximize the benefit for you. So if your general practitioner is not able to get your headache control so that you're able to continue to work and do your brain injury therapies and so forth, let them know and see if you can get a referral to a neurologist or to get referred to a headache clinic where you could see people who manage headaches and have them evaluate your headaches. With these healthy lifestyle habits, medication management, and time for your brain to heal will help you over time manage your headache pain. So some people get better from their headaches after a few weeks, while others may struggle with headaches for a lifetime. To share my own personal story, I had headaches for 4 years after my brain injury, and they weren't the same intensity as they were in the beginning. The entire 4 years, they just slowly faded, became less intense, less frequent. And then finally, one day, I just realized that they were gone, that I didn't have headaches anymore. And that was great, but I did have to wait 4 years for that. So don't give up hope if you are struggling with your headaches for a long time. It can happen. And I just hope that you see the right people to get the right help and that you feel better soon. Take care, get better, get stronger, and give me a follow. Talk to you later. You've been listening to the Mindful Return podcast with me, Kelly Tuttle. Subscribe wherever you listen and head to kellytuttle.org for brain injury recovery tools, free resources, and inspiration to help you return to work with confidence and hope.